We on this channel, I preach this body positivity and loving yourself and don't worry what anyone else thinks. And here I got this procedure to change how I look because I couldn't accept a part of myself.
Of course, ideally we would all just accept ourselves for what we are and who we are and how we look and all of that, and everything will be great. And I think some people are able to do that, but I think a lot of people are not. Dr. Gary here from City Facial Plastics in New York City. You guys probably saw my video now on my reaction to Zach getting a hair transplant, and now it looks like a year has passed and he posted another video how I fixed my balding 1 year after surgery. So let's take a look at the results.
A little over a year ago, I changed the biggest insecurity that I had. I got hair restoration surgery. A lot of people have been asking since then, what happened? Did it work? Is my hair fixed? And really, most importantly, how do I feel about all of this? Am I happy that I did it? I'm headed back to the Barber Surgeons Guild where I got my procedure. We're gonna go under the microscope and see what's going on with my hair follicles now.
And so today, we're gonna show you your original photo before we did anything when you came in, and then to where you are now. And I guarantee the difference will be very dramatic.
I was gonna do one of those really cool time lapses where I take a photo every day, and I did it 3 times. I took 3 photos. That's it. Whoops.
Let's take a look at the hair follicles. Look at these new guys.
I don't think there's anything wrong with losing your hair or being bald. I think there are a lot of guys that look great with it. First of all, every action star in the world.
Oh, and I forgot to mention, I have alopecia areata, so hence my hair is gone. Don't make fun of me.
Dwayne Johnson, Vin Diesel, Bruce Willis, Jason Statham, Walter White. I mean, basically the entire cast of Breaking Bad. Pitbull, Samuel L. motherfucking Jackson. You can look great bald, and if you're losing your hair and it doesn't bother you, like, go for it. But unfortunately for me, I didn't feel good about it. For a long time, my hair has been just a pure source of insecurity. Like, I was just embarrassed. I would watch videos and it just would kill me. I started wearing hats a lot, like a lot. So much of my time and my energy was just spent trying to hide it.
Yeah, I mean, I totally get it. It took a while for me to kind of come to terms with the new look and, you know, not wearing my cap everywhere. But I do wear my surgical cap because I actually do surgery, so that's why you guys see me in that a lot. But yeah, like coming to terms with it and going out in public, it's not easy as you kind of lose your hair.
I just didn't look the way that I thought I should, the way that I wanted to. I wasn't ready. I wasn't ready to lose my hair. We are now, I want to say 14 months from the procedure.
Sounds like a baby.
I know.
We're having a baby. How's your child? 48 months. When Zach first came to me, when Zach came to me, he had no style. No style, the journey was rough.
I cornered David at a party and I was like, you need to help me, man. I feel like we're an old Jewish couple right now. It was like the end of When Harry Met Sally and we're talking about how we met.
So when I first saw Zach, right here was the area of concern. And this too was like really back also, so it didn't really help the frontal lobe. And then also the famous yarmulke area. This was very, very thin. Right?
I'm low-key convinced that's why yarmulkes were invented. So that old Jewish men could be like, no, I'm good, I got my hair. You can't see anything.
Welcome to
Barber Surgeons Guild.
We don't have barbers doing surgery, we don't have surgeons doing barbering, but we have both, and we brought that back together.
What are we doing today?
You know, obviously we want to take a look, we want to get in there and see how things are looking.
So while we're here, I'm also going to be doing a second round of scalp camo. This is where I got my restoration. Come on in. Hello, Chappie, good to see you again. It's been a while. Is it doing it?
Yes.
You changed the name.
Yeah, Super Chappy.
It's Super Chappy now. When I first came in, what did you see with my hair? What was my diagnosis, so to speak?
So you had 2 things going on. You had hair loss, more severe in the front than the back, and you had active hair thinning the hair follicles themselves become thinner and thinner and thinner.
It's the same problem, right? It's called androgenic alopecia, so it all kind of stems from the same problem. There's a miniaturization process that goes on, and then eventually the hairs no longer exit the scalp surface. So I think he had one main problem.
Process known as miniaturization. And those hairs become so miniaturized, then eventually they stop becoming hairs and don't grow anymore. And that's sort of the point of no return.
Like the hairs are Benjamin buttoning. They become babies.
Yeah, exactly.
And then the baby becomes just nothing. So what are we doing today?
Just gonna do some blending. We're gonna extend the camo from the crown to the mid scalp where the transplant ended.
Let's go for it.
So again, they're doing that scalp micropigmentation to reduce the scalp show that Zach still has. It's just a reminder to people that it's not like one and done with the hair transplant, usually, especially with thin, fine hair that Zach has. And oftentimes you need to do something else to kind of maintain, other than medical therapy, which I sure hope that he's on. And it'll be interesting that, you know, to hear him kind of talk about that, if he takes any medications or does anything for prevention's sake, not for the transplanted hair, but for the pre-existing hair. And then he's getting this camouflage or the scalp micropigmentation to kind of further sort of blend the look and reduce that scalp shine through.
It's kind of now becoming known as the Zach package.
Wow.
It's small but powerful.
Yeah. Packs the mighty punch.
First, we did the camouflage, using this pigment to sort of mask that contrast between the lighter skin and darker hair. The reason we did that there was it really wasn't thin enough to warrant doing restoration there yet.
A lot of my hair was salvageable, and so getting on medicine has helped boost it.
Oh, okay, so you just said it there. He's on medicine, and that's great.
Thicken my follicles again. So this ink dissolves naturally within 5 years, and the idea is that as my hairs get stronger.
The ink does fade over time, but often I find that it doesn't completely go away, and that's something to remember for people who are looking to completely, like some people on my videos comment, oh, you should get scalp micropigmentation. My hair loss is a little bit unpredictable because of the autoimmunity kind of nature of it, but for people who are just bald and they want to get SMP, you just have to be careful because it often does still remain many, many, many years later, even though it kind of fades out a bit.
Ink fades away, but the hair then looks the same. Number one thing that guys ask me about when I tell them that I did this and that I'm on finasteride now, they hear that I'm taking a pill for my hair and they go, doesn't that f up? Literally every single guy has asked me, does your dick still work?
Hi, I'm Zach's penis.
And we are back together again.
The studies say up to 1 to 2%. In my personal opinion, I think that's a gross overestimation. I say that because we prescribe this to many, many, many people. Now, there is a small risk that you can have side effects, okay? Very small. You have side effects, we get off of it. I do not want people to be on a medicine that causes side effects.
Right.
But
I agree with Dr. Rome on that.
But the side effect of not taking it is losing your hair. So,
Which that loss of confidence, that's the real boner killer.
Right, exactly.
Totally.
Full circle, right?
You could technically give me a tattoo anywhere.
I could, but if I put a dot on your forehead, it would fade away in about 3 to 5 years.
If I could get like a 5-year arm sleeve, oh yeah.
When the hairs are gone, they're gone. You can't bring them back unless you put hairs back in there. So that's how we had to restore the front.
I was terrified of that surgery for a lot of reasons. One, I didn't want a big scar on the back of my head. Two, it just seemed painful. It seemed like the recovery would suck.
So just looking at Zach here, it does look like he's had a, kind of a nice restoration. He's still kind of combing his hair down over the forehead a bit, but I think it kind of works for him. It frames his face better, so it looks like he had a nice result.
The procedure we did left me with no scar whatsoever. It was a totally easy, pain-free procedure. But the days after the surgery, I was swollen. I was on these like really powerful steroid drugs. I don't know what I was taking. And I got really melancholy. I'm having this moment where like, I don't know what's happening. I'm all alone tonight, Maggie's at work. I'm having this moment where I'm regretting going come through with this.
Yeah, I mean, look, recovery is not easy for any surgery, and there's documented depression after facelift surgery in particular, but I think it can apply to any cosmetic surgery where you go into surgery wanting to look better and enhanced, and you spend money, and then you come out of it and you're all bruised up, swollen. It's going to take a while to see your final results, and a lot of people get down on themselves, and that's pretty common.
I didn't want to see anybody because I looked crazy, and I felt like an idiot. I don't want to be seen by people like this, and I don't want to have to explain myself all day. I guess I'm not having doubts. I don't know. The answer is I'm having doubts, but I don't know why. We on this channel, I preach this body positivity and loving yourself, and don't worry what anyone else thinks. And here, I got this procedure to change how I look because I couldn't accept a part of myself.
Yeah, I mean, this kind of gets into deep psychology. Of course, ideally, we would all just accept ourselves for what we are and who we are and how we look and all of that, and everything will be great. And I think some people are able to do that, but I think a lot of people are not, and the body changes over time, and the mind, in part, and our emotional state changes over time. So it's complicated, and a lot of people look to different procedures, whether it's surgical or non-surgical, to make themselves feel better and to present a different image to the world and to themselves. So it's complicated because I see a lot of people commenting on my videos like, oh, everyone should just go bald and be happy, and plastic surgery is stupid and all this stuff. But if only it was so simplistic. It's not.
And I just got so sad. As soon as the medicine wore off, I felt great. I was in videos at that time, especially if you look back at the early podcasts we did. My hair is so bare and receding, and it's short, so I can't hide it, but there was a real power in that. Like, it wasn't controlling me anymore. I was like, yeah, this is what my hair looks like, and guess what? It's gonna only get better from here. A lot of people have, reached out and they're like, would you recommend that I do this? And it's kind of to each their own.
Yeah, I agree. A lot of patients, we do a consultation, and at the end of it, they'll ask me like, should I get this done? I tell them I can really only comment on whether or not you're a good candidate or a candidate for surgery. The ultimate decision of whether or not you go through with it is complex, and it has to be done by you. Like, the decision has to be made by you, and I would be too biased to tell you like, yes, do it, or not do it, unless I feel like you're just medically or surgically just not a good candidate, then I'll tell you that. So I try not to comment on the subjective sides of things too much, because it's a dangerous road. And for example, like, I can do a great surgery and you can get a great sort of result. Like, if anyone were to look at your before and after, they'd say, oh yeah, this person looks better. But you might feel like you don't look better, or you might regret having had the surgery, even despite a sort of a semi-objectively good outcome, right? So it's complex. I think people need to kind of own it. Like, hey, I'm going to have surgery. It's going to be an expense. It's going to be a recovery. I'm doing it for myself, and I hope that it works out and that I look better, that I feel better, and I think that's the right mindset to go into this with.
This is not for everybody. If people are happy with the way they look, there's no reason they have to do this. If they want to do something for themselves because it makes them feel better about themselves, these are the things that are available to them.
I agree with that.
Now we're gonna go under the microscope, and we are going to see what the follicles look like a year later. And this is both from the restoration and from taking finasteride.
Let's take a look at the hair follicles. Look at these new guys. First of all, look at this. Very different picture than before.
That's the same area?
That's the same area, right?
Holy shirt.
Yeah.
Whoa.
Yeah, a lot more hair there now, and thicker hairs.
Yeah.
Very little miniaturization present.
This is why not to recommend restoration in that area at that time, because finasteride did its job.
I can't see any sort of thinning back here.
Yeah.
Honestly, between the camel and the finasteride back here, looks perfect.
Wow, that's cool.
Yeah.
So because Zach, you have a lot of hair, we're gonna take the opportunity to give you 3 different looks, but it is still thin. So just because you got surgery doesn't mean that it's still not thin.
Yeah, I'm still a Jewish man. I still have thin hair.
Ooh. So what we're gonna do is just cut your hair.
Zach's old hair can't come to the phone right now. Why? Because he's dead. Actually, it's alive now.
It's actually still alive.
Now it's more alive. If I'm just staring,
Like, I think this is the shortest I've ever taken your hair.
there are very few things I love as much as
A neck trim.
yeah. It feels so good. The thing I encourage to anyone is that the moment that you have that thought in the back of your mind, you're like, I'm too young to be losing my hair, but I think it's just go in for your consultation immediately. Because if I had done this 5 years earlier, I maybe would not have needed a restoration procedure right now. Ooh, I look like I'm ready to join an a cappella group.
I was gonna say, it's a very 50s vibe.
Yeah, I definitely encourage young men and women who are losing hair to definitely seek out a consultation from someone who knows how to do a transplant but also knows the medical side of things, like Dr. Rome or myself. You want to know what your options are when you first start seeing the problem. As Zach said, had he got on the finasteride or the minoxidil early, he may have been able to delay needing a transplant, and so that would have been nice, but it's great that he eventually got plugged in and got the right advice. You don't want to go to a place where they only do surgery, or someone who doesn't know anything about surgery and what those options are. Go into someone who's able to offer both perspectives and really not think about trying to pad their wallet and make money, but really doing what's right for the patient. I mean, I think that's the key. You want to find that type of person.
I look like I'm ready for a house party. Hey bro, do you want to crush some White Claw?
This is the crown before we did the camo and the finasteride course.
This was the top of my head.
This was the before.
No way. Whoa.
Yeah, that was the front.
I don't remember my hair ever looking
Yeah, no one
like
does.
that.
Yeah, it is pretty incredible when you look back at your original photos, and this goes for the facial plastic surgery that I do as well as the hair work. People are often quite surprised that, like, hey, I actually looked like this. It's easy to forget.
You see yourself every day through the process. You don't remember what it looked like originally.
That is like, I love it.
Yeah, that's the
I love
shot
it.
right there. So this was the old hairline, this line right here.
This is wild.
There's still some space between the hairs and the very front hairline, which is natural. But man, look at this density through these hairs. It just looks so good.
This is so exciting. You guys have no idea how long I've wanted to do the Founding Fathers hairdo. I finally can pull it off. This is
You definitely can. It looks great.
Now we're going for what would be my everyday look. Whoa! Wow! Look at him. This is good. This looks good, David.
So good. So good.
Go short on the side, leave it really long on the top. Maybe I'll do a top knot, maybe I'll do a bob.
It's nice to see him so excited about his hair. That's cool.
Go shoulder length. Maybe I'll get a perm like you. Can I pull that hair off?
You might be able to.
Wow.
No chance.
This is cool. I can say truthfully, fully, doing this did change my life for the better, and I am incredibly grateful to have linked up with you guys, and thank you. This is really exciting for me because for the first time in a long time, I have choices in how to style and cut my hair. Before, everything I was doing with my hair was just a reaction to try and hide or make the best with what I got. Now the power is in my hands. The power is in my hair. There's only one thing left to do, and that's to go full circle and confront my biggest fear. I'm just kidding, I'm not doing that.
Yeah, I mean, look how much more confident he got after the surgery. I mean, it's really astounding, So for some people, they take the route of, let me just shave it all off and then I don't have to deal with it and I'll get used to my new look. And that's fine. That's one way to go. Another strategy is to really get on the medical therapy and do surgery if that's right for you, and try to restore what you can and enjoy your hair, right? It's important for some, it's not as important for others. And then also it depends on your degree of loss, right? If someone has really significant loss very early on in their life, you might consider just to pull off the bald look, and it's gonna take a lot of surgical work to get you kind of looking presentable, right? But if it's something that's happening to a kind of a lesser degree, less severe, you might consider a surgery to make things look better and medical therapy at the same time to You want to preserve what you already have. So yeah, different ways to do this. I mean, I think if it were me, for example, and I was in Zach's shoes, I would also get the transplant. I think it's very reasonable what he did. I kind of wish a transplant was an option for me, but it's not, because I have a different type of condition. But I mean, I think there's nothing wrong with guys, you know, who want to get transplants, and there's nothing wrong with, like, for example, the Bald Cafe, you know, that guy who has a whole channel where people send in their stories about how they decided to go bald, and I think that's beautiful and empowering too. I think the most important thing is that people have a choice. They have a choice on whether or not they want hair restoration, or whether or not they just don't want it at all. And maybe they want to just look totally natural with that, you know, kind of a moon shape like Larry David or something. That's another way to go, you know? Just kind of work with what you got. If you went bald and lost your hair, then kind of sport that too. So whatever works for you guys. Hope you like that. Like, subscribe, and comment. Thank you.